Thank you so much, Mallika, for joining TeqTalk. Really appreciate your time.
Thanks for having me, Jess.
Before we actually start and deep dive into our core topic, why don't you tell about your career journey from where you started, what exciting things you're doing now, and your contributions overall?
If I think of my career, I'm going to date myself, but I'm an immigrant to the States. And right after grad school, I had an opportunity to work in strategy consulting and market research. And it really gave me exposure to different domains and industries, as well as different kinds of business problems. And then when I moved to the States, I was fortunate enough to get into the tech space. So my first gig in tech started in semiconductor. And then after that, I transitioned over to Hewlett Packard, the old HP, working on both hardware and software, as well as supplies. After that, I think, it's been a series of opportunities and life transitions that have led me to where I am today. About 16-ish years ago, I had an opportunity to get into healthcare when I moved to San Francisco. And I think the rest is history. I've really enjoyed being in this space. I also grew up in a family of clinicians. So I think
it's in the blood. Sorry to interrupt.
Exactly. So it's in my DNA. I guess I wasn't smart enough to become a doctor, but I had to sort of land there in a different format. And so here I am. I think when it comes to how every next opportunity has happened, some have happened because I pursued them, and others I was fortunate enough to be given the opportunity. And I've always approached everything with an open mindset, and also trying to figure out what is it that I should be doing and I should be doing differently to make an impact. I work in a federally qualified health center in Northern California, Mendocino Community Health Clinics. We offer medical services, primary care, behavioral health, dental, pediatrics, OBGYN, chiropractic care, as well as substance abuse disorder. Because we are a federally qualified health center, we are one of the only primary care choices in the area that we are located. And we have roughly around 30,000 patients that are, I would say, active patients that see us, and we have 4 sites. And it's been an incredible experience, I would say, in the last 3 years, being part of a community clinic, which is, if you understand healthcare ecosystem, is the safety net providing healthcare to millions of people in the States.
Of course, absolutely. And I think it's very interesting. Today's topic is centered toward FQHC. We will deep dive into that. Healthcare in the US is $5.3 trillion industry, which is approx 18% of the entire economy. And community health serves close to 34 million people, which is 1% of that total spend. So if you see that number, small community, but big responsibilities. Mallika, I would like you to explain the FQHC model, how it works, how it gets its funding, and what are some of the barriers you face every day?
So you're absolutely right. I think in the larger ecosystem of healthcare in the US, our contributions or spending might be relatively minuscule compared to the large healthcare entities. But then at the same time, if you look at the community care model, we are the safety net, which means because we get support or federal funds to keep us running on top of getting revenue from just offering patient care services. We also are unique in the sense that we keep our doors open regardless of the patient's insurance status. And so we offer a sliding scale fee to those folks who are uninsured. So if you look at the patient population or people and the community that we serve, anyone can walk into our clinic and get care. So I think that makes us extremely unique. I think in light of some of the challenges and problem areas, I think healthcare, as every entity is going through today, is facing a lot of regulatory pressures. And so any changes in the federal landscape do affect us. So that is a reality. I think secondly, the cost of healthcare continues to increase. Inflationary costs, supply-demand pressure. In our case, we have an access issue. What I mean by that is we have a lot more patients requiring our help than we have
the
resources, providers and support. So it's always a little bit of a catch-up game, so to speak. Ideally, we'd like to keep our doors open and take in anyone that just walks into our door. But in reality, that can be a little bit challenging, especially if you don't have enough care teams as well as providers. So that is a problem. That's not just unique to us. It's actually a worldwide problem.
Exactly. That is what I was about to say, that in overall healthcare, if you see, the demand is so high. And if you see the resources, there is always a crunch. Mallika, what could be the reason why we are having less resources? Why people do not want to be a therapist or a doctor or a clinician? What are the reasons?
You hit a sensitive spot there, but I think it's a problem that is well documented and well recognized across the world. So I think one of the biggest barriers / reason why we have that supply demand gap is we just don't have enough workforce who can support the healthcare, the growing population across the world, the growing aging population, as well as all the people that need care.
And what is the reason of not having that workforce? Why people do not want to come into this line? Is it because of a lot of burnout or a lot of pressure, or what exactly?
You hit on one very important and yet very well recognized barriers and problems in the healthcare area. There is a lot of burnout, and a lot of the burnout has been due to increased regulatory pressures. So anytime there are more requirements, whether it's coming from the payer or the regulators in the industry, it puts pressure on healthcare entities like us. And what that pressure essentially does is we have to do more in the way of administrative work as well as increased documentation. And so when you think about yourself or me as a patient, when I walk into a doctor's office, all I'm expecting to happen is that they know exactly what's going on with me and they have a prognosis or a treatment plan that's going to make me feel better. But what you don't see is everything in the background that happens after that care is delivered, and also what's happening during that care. When your chart is open and then the provider is doing the documentation, there are so many details that are required for that patient care to be delivered successfully. When I say successfully, is it resulting in a better outcome? Are you able to get a treatment plan that you're able to follow through? Is your insurance coverage going through? Do you need any prior authorization? Are there any billing gaps? So the whole revenue cycle thing. So it's fairly complex. So I think obviously given the intensity of that administrative burden, it causes severe burnout. I think on the other hand, if you look at, what it takes to go into medical school, it's extremely expensive, and here it can take a number of years, and there's just not a lot of resources that are available that can foster that, right? So you want a system that can encourage that, whether it's scholarships or other kinds of funding. And so when you don't have that available, it becomes one of those luxury products and areas. So I think that's another problem. I think the third is, rising costs of care can put intense pressure on healthcare entities. And so not everyone is able to be financially sustainable. And when financial sustenance becomes an issue, not everyone survives. And so then what happens is you have fewer number of institutions that are required to take care of the bigger population. And so there's always going to be that supply-demand gap. And so when you have that supply and demand gap, it puts intense pressure on those that are already in the workforce and are required to take care of all those sick people, right? So those, I think, in my opinion, are some of the major reasons why, this industry, it is the way it is. I think the community care model, we didn't have all the barriers and all the regulatory pressures, can, in a perfect world, be the model of how primary care is delivered in the future.
Yeah.
We also have a significant dearth of specialists. So when you don't have enough specialists and a lot of it has to be done in primary care, again, it creates another supply-demand gap and additional pressure. So that is also, I would say, another reason why this industry is facing all the challenges.
County health ranking suggests that clinical care contributes only 20% to any health outcome of any human. And the rest, 80%, is still influenced by the social and economic factors. So these factors could be the nutrition in the household the person is consuming, transportation, employment, what kind of community support the person is getting, right? And I can also see that there is a shift going on right now in healthcare, which states that I just do not want to cure this person right now. I have to make sure that we have a good and healthier population in next 5 years. So this is the mindset change going on. What do you think about it?
Yeah, you're absolutely right. There's a concept called whole person care.
Yes.
Which has existed in the academia for a number of years and is slowly becoming the model of care for the future. And I think it's really important to recognize and understand that we need to first address structural needs gaps.
Yeah.
Food, housing, transportation. If I don't have a roof over my head, I can't show up in the doctor's office.
Exactly.
If I can't have transportation, I still can't show up for my appointment. And so even before you address the person's health condition from a clinical perspective, you need to address their health from a structural barriers perspective.
Yeah.
And so where I work at, we have an approach and a process to capture that information across our community and across our patient population. In addition to that, we've always been invested in our community health. And so one of the other source of funding for FQHCs is through grants. Again, it's not a steady state, but grants can be extremely instrumental, not just in the way of giving us that buffer from a revenue perspective, but also allowing us to build capabilities that otherwise we don't have the resources to. And so on the community health side, I had an opportunity about almost 3 years ago to stand up a community health group where I work at. And so it's been a very fulfilling and the most satisfying journey to see the outcomes and the impact that we've been able to create in the community.
Can you talk more about it? What exactly you built and how you are putting this whole person care into your day-to-day practices?
Yeah, absolutely. So we had to, one of the issues that I saw in the industry and across the population is knowing that every third or every other patient has some gap around structural need. And that they require a warm touch, whether it's in the form of an outreach call or someone who's able to talk to them and ask them, hey, do you need help? Can we connect you to a set of resources? So we were able to establish that across a smaller population in the community, but starting with our most vulnerable patients, patients coming out of the rehab center, patients coming out of the carceral facility, and patients coming from inpatient settings. So some of these patients that we started out with, or the individuals that we started out with, were not people who were set up to live independently and live healthy independently. So they needed someone like a case manager, a community health worker to go and get in touch with them and understand what their needs are and what kind of resources they need to be able to establish and get better so that they could live independently in the future. And so the community health workers would go and meet these people where they are at. Sometimes it's in a coffee shop, sometimes it's in the rehab center, sometimes it's in a jail, sometimes it's in the hospital. And so we would get referrals from a variety of sources in the community. And the nature of the community health work is one of those wherein you need to build a network of community-based resources in those settings that you're offering this. And so as it was, the journey involved not only building a set of community health workers who are comfortable and who had that experience and lived experiences to go and serve these individuals in the community who are very vulnerable, but also being very systematic about how we approach these community-based organizations, some of who were also offering similar services to us, but in some cases unique services, whether it's food stamps, whether it is temporary housing, and sometimes it's just peer support, right? So it took almost 2 years to build that network in the zip codes that we were servicing.
It's not
and
easy. It's a big thing.
It is absolutely not easy. And the type of work can be extremely, you talk about burnout, this is a very different kind of burnout because some of these patients, they don't have a phone number that you can consistently reach out to. So when you have numbers that are changed and people that don't pick up the phones, you have to keep on calling. So we have to establish some guardrails around, what should be that outreach approach and where all can we be going to, and what kind of safety can I, as the employer, as the leader, enable my community health team to feel safe and to be able to go out and meet these people, right? And then how do we bring all these community organizations together so that we are all marching towards a common goal and a common mission? So oftentimes when you have these common areas or common goals and vision of what you're trying to accomplish, you're going to see better buy-in. So I think it was important for us to understand from their perspective what it is that they are marching towards, share our objectives and goals, and then find where that common and middle ground is, and then get the support. So, I'm probably simplifying it by saying what I'm saying, but it's a number of little things.
Huge
that's
process.
going, and it's like a team play, right? You need every individual and every entity to be doing their best for this to make the biggest impact that it can have. And, like with anything, you're going to have churn, people come and go, but then how do you still keep that work going? So those challenges are obviously real and something that you have to always keep at the back of your mind and then figure out how you're going to overcome it. But I do think community health workers are a very important entity in the landscape of healthcare, especially when it comes to addressing structural need and social needs gaps. Because like you said, more than 80% of a person's health is attributed to non-clinical related factors.